Mga kapuso, maniwala po kayo, mahal magkasakit dito sa Pilipinas. Batayan mismo sa datos ng ating gobyerno, pati na ng mga eksperto. May ibsan sana yan kung mas mura ang mga gamot.
Imagine this. A loved one falls seriously ill, and the first question isn't about treatment. It's about cost. In the Philippines, this is the reality for millions of families. Healthcare isn't just a necessity. It's a financial burden. Today, we uncover the harsh truth about the high cost of healthcare in the Philippines and what it means for the everyday Filipino. The healthcare system in the Philippines is a tale of two realities. On one hand, you have private hospitals with state-of-the-art facilities that rival global standards. On the other, you have public hospitals bursting at the seams with patients often lacking enough beds, doctors, or medicines. The Philippine healthcare system is composed of two main sectors, public and private. Public healthcare is funded and managed by the government, catering to the majority of Filipinos, especially those from low-income households. Meanwhile, private healthcare serves a smaller, wealthier segment of the population, offering higher quality services at a premium cost. In 2023, public hospitals accounted for 63% of the total healthcare facilities nationwide. Yet, they are disproportionately underfunded and understaffed, especially in rural areas. The patient-to-doctor ratio in public hospitals is 1 to 33,000 in some provinces, far from the World Health Organization's recommended ratio of 1 to 1,000. Accessibility to healthcare depends heavily on where you live. Urban centers like Metro Manila and Cebu City have more hospitals, clinics, and specialists, giving residents more choices. But in rural areas, where over 55% of the population lives, the situation is starkly different. For many Filipinos in remote provinces, the nearest hospital could be hours away. Ambulances are scarce, and healthcare facilities are often poorly equipped. This lack of access leads to delays in treatment, sometimes with fatal consequences. Even in urban areas, public hospitals face their own set of challenges. Overcrowding is a persistent issue, with some facilities operating at 150% capacity or more. This overcapacity strains healthcare workers and compromises the quality of care. Nurses and doctors often work double shifts, attending to hundreds of patients daily. For the sick, waiting times can stretch for hours or even days just to get admitted. To address these gaps, barangay health centers play a critical role in primary healthcare delivery. These centers are designed to be the first point of contact for basic medical needs, such as immunizations, maternal care, and health education. While these centers provide essential services, they are often under-resourced. Many lack proper facilities, medicines, and trained staff. This leaves barangay health workers stretched thin, doing their best with limited tools. The state of healthcare in the Philippines is both a challenge and an opportunity. While there are efforts to improve the system, such as the Universal Healthcare Act, implementation remains slow. Public hospitals still need funding, barangay health centers require resources, and the private sector must collaborate to make healthcare more affordable. The Philippines is home to vibrant communities and hard-working individuals, but when it comes to healthcare, many are left grappling with one unavoidable truth. Healthcare is expensive. But why is this the case? What drives the soaring costs that burden millions of Filipinos every day? One of the biggest contributors to the high cost of healthcare in the Philippines is the price of medicines. Filipinos pay some of the highest prices for prescription drugs in Southeast Asia. This is because many medicines are imported and sold at a significant markup by pharmaceutical companies. For example, a commonly prescribed maintenance drug for hypertension might cost 1,500 pesos in the Philippines, while the same drug is sold for half the price in Thailand. Why? Weak regulation on drug pricing and the dominance of multinational pharmaceutical companies keep prices high. While generic drugstores have made medications more affordable for some, there's still a long way to go in ensuring that every Filipino has access to life-saving medicines at reasonable prices. Another factor is the dominance of private healthcare providers. Private hospitals, while offering state-of-the-art facilities and shorter waiting times, often charge exorbitant fees. A simple consultation can cost as much as 1,000 pesos to 3,000 pesos, excluding diagnostic tests. Even basic procedures like x-rays or blood tests can set patients back thousands of pesos. For many families, these costs are a luxury they cannot afford. The government's limited investment in public health care forces Filipinos to rely heavily on private providers. Over 70% of healthcare costs in the Philippines are paid out of pocket, making it one of the least accessible systems for low-income families. PhilHealth was designed to make healthcare accessible to all Filipinos. But despite its promise, the reality is far from ideal. Many procedures and treatments are only partially covered, leaving patients to shoulder the bulk of the expenses. Additionally, millions of Filipinos remain uninsured, particularly those in rural areas or working in informal sectors. This lack of universal health coverage means that one illness can lead to financial ruin. From overpriced medicines to limited public health services, the high cost of health care in the Philippines is a multifaceted crisis. Without systemic reform, millions of Filipinos will continue to bear this heavy burden. For many Filipinos, getting sick is not just a physical challenge, it's a financial one. The cost of common medical treatments often outweighs what the average household can afford, forcing families to make impossible choices. Let's dive into the numbers to understand the true cost of healthcare in the Philippines. Let's start with something simple: maintenance medicines. For conditions like hypertension or diabetes, the monthly cost of medication can range from 1,500 pesos to 5,000 pesos. For many families earning minimum wage, this already takes up a large portion of their income. And that's just for chronic illnesses. When you factor in one-off illnesses like the flu, dengue, or typhoid fever, the costs quickly pile up. Lab tests, doctor's consultations, and prescriptions can easily cost 5,000 pesos to 10,000 pesos per visit. For those requiring hospitalization, the expenses are even more staggering. A single day in a private hospital can cost anywhere from 2,500 pesos to 10,000 pesos, excluding professional fees, lab tests, and medication. Even in public hospitals, while room charges may be lower, families still bear the brunt of medication and additional services. Unfortunately, limited capacity often pushes patients into private facilities. Now, consider specialized treatments like dialysis. For individuals with chronic kidney disease, dialysis is a lifeline, but one that costs an average of 3,500 pesos per session. With most patients requiring 3 sessions a week, that's 42,000 pesos a month or over 504,000 pesos a year. For life-saving treatments like chemotherapy or heart surgery, the figures become astronomical. Without private insurance or significant savings, these treatments are out of reach for most Filipinos. Emergencies bring their own set of financial challenges. A simple trip to the emergency room can cost 1,000 pesos to 20,000 pesos, depending on the severity of the case and the facility. For many, these sudden expenses lead to long-term financial hardship, with families resorting to loans, pawn shops, or crowdfunding to cover the costs. To put these costs into perspective, the average monthly income of a Filipino is 25,000 pesos. Even a single hospitalization can wipe out months of savings or plunge families into debt. For those earning minimum wage, the situation is even more dire. The high cost of healthcare in the Philippines is not just a financial issue, it's a humanitarian crisis. It forces families to choose between life-saving treatments and basic necessities, leaving a lasting impact on their futures. In the next chapter, we'll explore how government policies and systemic issues contribute to this ongoing crisis. For many Filipinos, PhilHealth is a lifeline they turn to during medical emergencies. But is it enough? Despite its mission to provide universal health care, PhilHealth has significant limitations that leave millions struggling to afford proper treatment. The Philippine Health Insurance Corporation, better known as PhilHealth, was established in 1995 with a goal to ensure that every Filipino has access to affordable health care. It's a mandatory program for workers, with contributions deducted monthly from salaries, while indigent Filipinos and senior citizens are covered by government subsidies. PhilHealth categorizes members into 4 groups: the formal economy, who pay through salary deductions; the informal economy, which includes self-employed individuals; indigents and senior citizens, whose contributions are sponsored by the government. Despite this seemingly inclusive structure, many gaps remain. While PhilHealth promises to shoulder a portion of medical costs, the reality is that its coverage often falls short. For instance, while PhilHealth provides case rates for specific illnesses, patients are left to cover the balance. For expensive procedures like surgeries, cancer treatments, or long-term dialysis, out-of-pocket costs can run into hundreds of thousands of pesos, far beyond what PhilHealth can cover. Beyond the limited coverage, accessibility is another critical issue. Many Filipinos, especially those in rural areas, struggle to register for PhilHealth or access its benefits due to bureaucratic red tape and a lack of awareness. In remote provinces, even PhilHealth-accredited hospitals and clinics are sparse, forcing patients to travel long distances for treatment. For the poorest Filipinos, the costs of transportation and accommodation make healthcare even more unattainable. One of the persistent issues plaguing PhilHealth is delayed reimbursements to hospitals and clinics. This has caused financial strain on healthcare providers, leading some hospitals to demand upfront payments from patients or even decline PhilHealth-covered cases. These delays have undermined public trust and limited the program's effectiveness. PhilHealth's benefits are primarily geared toward inpatient care, but for outpatient services, like regular checkups, laboratory tests, and maintenance medications, the coverage is minimal or non-existent. This gap discourages preventive health care, leading to late-stage diagnoses that are far more expensive to treat. Adding to the challenges is the issue of corruption. In 2020, a massive scandal rocked PhilHealth, uncovering alleged fraudulent schemes involving ghost patients, overpriced IT systems, and billions of pesos in missing funds. Reports revealed that over 15 billion pesos were allegedly mismanaged or stolen, money that could have funded healthcare for millions of Filipinos. This scandal not only eroded public trust, but also highlighted systemic issues within the organization. PhilHealth was designed to protect Filipinos from the financial burden of illness, but its limitations, inefficiencies, and controversies have left countless families vulnerable. Without significant reforms, the system will continue to struggle to fulfill its purpose. How can we rely on a system that has failed us when we need it the most? Behind every hospital bill lies a story of difficult choices. For many Filipino families, a single medical emergency can erase years of savings, plunging them into poverty. Studies show that 1.5 million Filipinos fall into poverty annually due to out-of-pocket healthcare costs, forcing families to cut back on essentials like education and food to cover medical expenses. The financial strain comes with an emotional toll. Guilt, anxiety, and helplessness haunt families who cannot afford proper treatment for loved ones. The worst outcome, however, is the loss of lives. Preventable deaths from conditions like heart disease and stroke remain common simply because timely medical care is out of reach for many. This crisis affects us all. When health care is inaccessible, it traps families in cycles of poverty and reduces national productivity. Chronic illnesses and untreated conditions lead to lost income, economic setbacks, and weakened communities. The human cost of expensive health care is too great for Filipinos to bear any longer. Fixing the healthcare crisis in the Philippines requires more than just government reforms. It demands action from individuals, communities, and private organizations. While systemic change takes time, there are practical and realistic steps we can take today. Local communities can take healthcare into their own hands by strengthening barangay health centers. This means maximizing available resources to focus on basic care, such as vaccinations, maternal health, and chronic disease management. Support for initiatives like medical missions, health fairs, and local fundraising can fill gaps where government services fall short. One of the simplest ways to reduce healthcare costs is by preventing illness. Communities can organize grassroots campaigns to promote healthy habits, such as proper nutrition, regular exercise, and avoiding smoking and excessive alcohol consumption. Practical solutions like community gardens, fitness programs, and free health education can empower Filipinos to take charge of their health without spending a fortune. Private companies and NGOs can play a vital role by partnering with communities to provide affordable healthcare services. Discounted or subsidized medicines, health cards, and low-cost telemedicine services are already making a difference for many Filipinos. Telemedicine, for example, has become an accessible and cost-effective way for families to consult with doctors, reducing transportation and consultation expenses. Generic medicine offers the same benefits as branded drugs at a fraction of the cost. By choosing generics and supporting pharmacies that prioritize affordable medicine, families can manage healthcare expenses more effectively. Filipinos can save thousands of pesos annually by switching to generics for maintenance medication and over-the-counter drugs. For those who can afford it, health insurance provides a safety net for unexpected medical expenses. While PhilHealth offers basic coverage, private health insurance plans can cover hospitalization, critical illnesses, and long-term treatments. Microinsurance products are becoming increasingly popular and can be a lifeline for low-income families. In times of need, Filipinos often turn to the spirit of community solidarity. Strengthening support networks, such as savings groups, cooperatives, and community crowdfunding efforts, can provide immediate assistance for medical emergencies. Even Filipinos abroad can contribute by supporting community healthcare initiatives or sending donations for local health programs. Employers can also help ease the burden by offering affordable healthcare benefits to their workers. This includes HMOs, wellness programs, or even providing access to discounted healthcare services. Small and medium-sized businesses can partner with HMOs to provide affordable group plans, ensuring that even employees in lower-income brackets have some level of coverage. While we wait for larger reforms, Filipinos can demand transparency in how healthcare funds are allocated and spent. Engaged citizens who hold both public and private institutions accountable can push for better use of resources. Supporting leaders who prioritize healthcare at the local and national level is one step toward long-term improvements. Solving the healthcare crisis in the Philippines doesn't require waiting for the government to act. While systemic changes are important, meaningful progress starts with us, ordinary Filipinos, communities, and private organizations, taking steps to address the challenges within our reach. By working together, making smarter health and financial choices, and supporting practical solutions like community-based healthcare, affordable insurance, and preventive care, we can empower one another to overcome the barriers to quality healthcare. It's not about waiting for a perfect system. It's about creating small, impactful changes today that will lead to a healthier, more resilient future for every Filipino. Thank you for watching and taking the time to understand the challenges we face with healthcare in the Philippines. If this video resonated with you, please give it a thumbs up and share it with your family and friends. It might just start an important conversation.